Coronaviruses are in the news. Coronaviruses are a family of respiratory pathogens, usually quite benign, not unlike a lot of other RNA viruses. Although the COVID-19, or SARS-CoV-2, SARS-CoV-2, that's a quick name for it, is hypervariable. And hypervariable means that it changes its character regularly, which means it's going to be hard to characterize it at a point in time and then go off and do safety, tolerability, efficacy studies on a vaccine. Because by the time you have done all of that necessary background work and safety efficacy work, the organism has likely been promiscuous with its DNA, with its RNA, promiscuous with its genetic material, and changed. Now, more than 10% of the cases that have been reported are severe. And about 2% of the cases that have been studied thus far have passed. Oh dear. But that's about the same rate as the seasonal flu. And depending on how you look at the numbers, somewhere between at least 25 or 30,000 and maybe twice or more that number of people in America passed because of the flu, because they are frail and infirm in almost all cases, at risk, overstressed, overfed and undernourished, environmentally intoxicated, through no fault of their own, but just it's the 21st century. So it is the people with chronic lung problems, especially those who smoke tobacco. It is those with cardiovascular disease. If you have coronary or atherosclerotic disease, you are more at risk of anything that changes the blood flow, that restricts the exchange of oxygen and carbon dioxide, which is characteristic of all of the respiratory, cardiorespiratory viruses. And if you're a diabetic who's not controlling your blood sugar, you're at higher risk. And the numbers I've seen have been about 10% of people with significant cardiovascular disease or prior lung respiratory problems, and about 7% of diabetics who are not controlling their hemoglobin A1C, for example. And when you do all the math, that turns out to be the 2% of the people who are passing. So if you're a healthy person, stay tuned, because I have suggestions to tune up your immune defense and repair system so that your risk goes down substantially, even as your understanding goes up dramatically. Now, for whatever reason, in the initial 30, 40, 50,000 people reported, men seem to be at more risk than women. But again, men do more tobacco smoking there. Men are more likely to be at risk of cardiovascular disease, etc. So stay tuned. By reference, this is not more aggressive than the SARS 2003 fear of pandemic, fear of widespread viral illness. MERS, another family virus similar to this. Actually, that one seemed to be more aggressive, but was contained with good public health measures, and most importantly, identifying those who are at risk and helping them rest and rehabilitate, recover, rather than persevere and possibly be significantly adversely affected. Now, how is COVID-19 spread? This is still an open question. Some people are suggesting that it may be a month or more of incubation after exposure before you know whether the person is or is not infected and able to communicate the infection to others. Usually it's about 2 weeks. That's what it is for most infectious viruses. So there we need to understand the host hospitality equation better. There's a professor named, I think it's Lori Grelinsky, and she points out that if you have a healthy lung function and get exposed and even infected, you'll recover and it'll be quite benign. It's the people at risk of lung, heart, and or metabolic problems like diabetes that are at risk. Okay, now what to do according to PERC Integrative Health? First, stay well hydrated. Herbal beverages and water are your beverages of choice. You should be wanting to urinate about every 2 hours while you're awake. And if you happen to have any caffeinated or adult beverages, add an extra glass of water. For example, if you get an espresso in much of the Mediterranean world, they automatically bring a little glass of water so that you won't get dehydrated and you will want to come back. Now take fully buffered PERC Potent C-Guard, the fully buffered, fully reduced L-ascorbate based on the C-cleanse, or however you choose to determine the ascorbate need. But ascorbate is the mother antioxidant and the most powerful natural antiviral agent that we know of. Then take PERC Mag Plus Guard, 2 capsules, and PERC choline citrate, a teaspoon, at least twice a day to keep up with your daily needs. That's about 440 milligrams of elemental magnesium and enough choline and citrate to enhance the uptake, chaperone the delivery, and deliver many other benefits, including acetylcholine, a soothing neurotransmitter, neurochemical in the gut and central nervous system, a more soluble bile to keep the gallbladder and liver healthier. And choline itself balances out inositol as a communications molecule or amplifier of signals at cell membranes. So lots of benefits of PERC Mag Plus Guard combined with PERC choline citrate. Then take enough PERC LifeGuard capsules to keep your urine sunshine yellow. That provides you a super B complex that's really comprehensive, a super mineral full comprehensive, usually a separate formula, a separate product from most other companies, and other cofactors. Because unlike most multis, even the super multis that have 17, 20, 22 ingredients, we have near 40. Because you need them and they're in meaningful amounts and they all work together synergistically in the novel PERC capsule form. Now, we do recommend PERC LivaGuard because it is a comprehensive liver support. It would be 1 to 2 micellized soft shells of PERC LivaGuard twice a day. Prepare for restorative sleep. A salt and soda, Epsom salts and baking soda warm bath. And when you get in, 5 minutes of slow abdominal breathing, followed by 15 minutes of active meditation. ActiveMeditation.org is a resource online that will help introduce you to the process that Dr. Robert Leichman introduced, that is active meditation, the Western tradition, in the mid-1970s. He was one of the people I went to debunk and became a student of. Then eat, based on your LRA by ELISA Act tests, eat what you can digest, assimilate, and eliminate without immune burden. A healthy digestion breaks food down to elemental building blocks. The body assimilates that, and if there are any parts that need further processing to get them down to the smallest possible level, there are mucins and secretory IgA. There are a variety of defensins and opsonins, a variety of things that healthy people produce when they're perked up. You may want to improve the air quality with a room ionizer, a point-to-space discharge ionizer that adds electrons, takes pollutants out of the air, and most importantly, is point-to-space in discharge, which means it freshens the air without creating ozone. So to your well-being, PERC Integrative Health is dedicated. As someone who has been perking people up for now 3.5 decades, it's a privilege to have this much experience and confidence. And whether it's coronavirus or some seasonal virus, whether it's an infection or a parasite, whether it's anything that reduces your quality of life or ails you, PERC Integrative Health is here to promote quality of life, to reduce risk, to correct deficits, to enhance your neurohormonal balance, your immune defense and repair competence, your digestive and metabolic efficiency. So, To your and our well-being we are dedicated. We are grateful for the opportunity to serve, and thank you. Thank you for your interest.